I can say that I've saved 42 lives in the last 2 months. I don't prescribe very often. Generally I'm behind the microscope or in the lab, but from one case to another and nobody doing anything. Elderly, obese, 83-year-old, 72-year-old, asthmatic, diabetic, to a T, every person that's had COVID I've treated with this has been better in 12 to 48 hours.
That is the sitting physician on the Central District Health Board, clinical pathologist Dr. Ryan Cole, before he was appointed to that position. Months before, in fact, back on March 4th, during a Capital Clarity event hosted by Idaho's Lieutenant Governor. Dr. Cole, who owns Cole Diagnostics in Garden City, and whose specialty is dermatopathology, studying skin cancer through a microscope, Dr. Cole claimed back in March, as a pathologist, he had prescribed ivermectin to 42 COVID patients over a 2-month period because, he said, they couldn't get that kind of help anywhere else. And there's a reason for that. The parasitic drug ivermectin hasn't been FDA or CDC or even WHO approved to treat or prevent COVID-19. In fact, they've actually advised against it. And a vast majority of Idaho doctors have followed that guidance and not given ivermectin to their patients. Well, not only did Dr. Cole go against that guidance back in March, he continued to do so through at least August 17th, when we spoke with him about his appointment to the CDH board. Are you still prescribing ivermectin?
When somebody's acutely ill, I do help people when they need it. So yes, when patients are acute, no other doctor will help them. In the middle of a pandemic, why would I not help somebody?
Do you know ballpark or even a specific number, how many you prescribed with ivermectin?
Couple hundred.
Okay.
And 95% have been better in 24 to 48 hours.
A couple hundred. And that was a couple months ago, which also happens to be the last time Dr. Cole has responded to our request to speak with him. But that couple of hundred prescriptions, not all of them in Idaho, by the way, as Dr. Cole admitted to the Idaho Capital Sun back in July, his patients were from across the country. Well, those prescriptions, just one of the reasons. There have been not one, but at least 5 complaints filed against Dr. Cole with the State of Washington Medical Commission. Dr. Cole is a licensed physician in Idaho and 11 other states, including Washington, which he was back in 2007. KTVB received summaries of those complaints today, and the allegations center around Dr. Cole spreading misinformation about the COVID vaccine and for prescribing ivermectin to patients, despite the absence of the, quote, proper physician-patient relationship as listed in one complaint. The misinformation part stems from what Dr. Cole has said in interviews, online, and in those Capital Clarity sessions. He's been to a couple of them, like referring to the vaccine as needle rape, or claiming the vaccine has killed thousands, which hasn't been proven. He's also said there is a direct causation between the vaccine and more pregnant women suffering miscarriages. Well, studies show that isn't a fact. And back in that March event at the Idaho Capitol, Dr. Cole claimed the vaccine was a product of a conspiracy, not what it was claimed to be.
What we have right now is an experimental biological gene therapy immune modulatory injection. We are injecting people with a synthetic sequence of nucleic acid. We have never done this on a large scale in human history. mRNA trials in mammals have led to odd cancers. mRNA trials on mammals have led to autoimmune diseases, not right away, 6, 9, 12 months later.
And those claims that you just heard Dr. Cole say have been proven false by several entities across the country. So the Washington Medical Commission says they are investigating Dr. Cole, something Physicians for Human Rights said should happen. About a week ago, they put out a release. Doctors who repeatedly spread misinformation and disinformation about COVID-19 and vaccines should face disciplinary review and actions, including the revocation of their licenses. They're following the lead of the Federation of State Medical Boards, who said the same thing back in July. Now, similar complaints have been filed with Idaho's Board of Medicine, and we're told they plan to take up this issue at their next board meeting. But we likely won't know if they decide to investigate Dr. Ryan Cole. We will only know if they decide to take formal action. But the newest member of the largest health district in Idaho, one that is supposed to guide our public health policies, the lone physician on that board, Dr. Ryan Cole, is under investigation for his views about the deadliest public health crisis we've seen in our lifetime.